Is Lyme disease a growing problem in BC, or is it nothing to worry about? While that debate plays out, a Vancouver Island family is off to the U.S. for emergency treatment. Parents say their 23-year-old daughter has Lyme disease, but the B.C Healthcare system insists she doesn't, and so they're paying their own way to get her the treatment they say she desperately needs.
The parents of 24-year-old Marie McQuay are determined to get their daughter better. They're convinced she has Lyme disease, a debilitating illness that has left Marie too weak to even walk on her own. For years, this Duncan family says they've been fighting to get treatment for their daughter, but say the BC Healthcare system has let them down.
The majority of the people that I've talked to are refused by their family doctor and the infectious disease specialists to explore Lyme disease and treat it.
So now, using their own money, the McQuays have chartered a jet at a cost of $14,000 to fly to California to get medical help. Also joining Marie, several others like Shannon who claim they too have the disease and are being ignored.
Fighting this disease, living with this disease is a nightmare enough, and then to have to battle your way through a medical system that leads you nowhere and just puts up roadblocks in your quest for health. We just keep shaking our heads and saying we cannot believe that it has come to this.
Dr. ERNIE MURAKAMI, a former GP and UBC professor, says he's treated hundreds of British Columbians for Lyme disease since 1994. According to the College of Physicians and Surgeons of BC, he agreed to resign this year and not reapply for a license in BC or anywhere else.
The IDSA guidelines were drawn up by doctors, okay? But there's been flaws in the whole process. And because doctors are afraid to work against the guidelines, they will say, okay, short-term treatment, and that's all I'm going to do.
But the BC Centre for Disease Control stands by its guidelines and testing practices.
The testing that we are providing for our client or patient, which is the state-of-the-art technology, and we follow the guideline, which is kind of stringent guideline.
Marie's parents say she may have contracted Lyme disease when she was bitten by a tick while hiking the West Coast Trail back in 2002. They had her tested in the U.S. at a private clinic, and that test came back positive.
The testing protocols that are being used by the treatment facilities and the testing facilities in the United States are far less rigorous, have a far lower threshold in terms of screening for Lyme disease.
Still, the McQuays are taking their chances and heading south, determined to get their daughter well.